society in holistic development of teenager. Thank you.
Thank you, Dr. Poonam. Good afternoon, everyone. And I would like to thank AHA for giving me this opportunity. My topic for today is the learning environment, how schools shape adolescent health. So before I start, I would like to show actually some few data points. So adolescents spend almost about 40 to 50% of their waking time in school. All right, almost 80% of the adolescents, they have insufficient physical activity. In India, more than 50% of the adolescents consume junk food at more than twice a week in school canteen. And poor ergonomics is related to back pain in almost 30 to 60% of the school students. 33% of the Indian school students reported high exam stress, and 30 to 40% of adolescents face peer bullying in school. So there are many risk factors which actually originate in school and mainly leading to sedentary life, high stresses, poor diets, and bullying. So what is the goal? The goal is to build a school which actually protects health instead of destroying it. So if you look at the school setting or the school environment, it contributes to physical health through nutrition, activity, and daily routines. Mental and emotional health through stress levels, peer relationship, and teacher support. Social development by instilling values, resilience, and lifelong lifestyle habits. There are also hidden determinants of adolescent health through classroom stress, peer pressure, bullying, inclusivity, play, ergonomics. A large number of bullying actually occurs on the playground, where especially for boys, there's a huge amount of bullying which occurs. Inclusivity is not there, so the child feels cut out, neglected, and all of them shape long-term outcomes. So the school environment is very important and becomes a key determinant of health, identity, as well as social values. So what is the impact on physical health? If you look at it, you will find nutrition and meals. School canteens play a very important role. And many times you will find that school canteens serve a lot of junk food because that's what sells. Most of the schools, they actually, outsource it to a vendor, and the vendor wants to make money out of it. And that's the reason where they sell a lot of junk food. And as a result, they would have more than 50% of the students would have junk food more than twice a week. And how can you prevent that? You can have healthy canteens. You can actually put some sort of a penalty onto the school canteen vendor. That is also possible. And weekly, you can have a no junk day, fruit day. Nutrition awareness posters, get one dietitian also involved. Physical activity. Almost 80% of the students, they are not physically active. So physical activity must be made mandatory. 30 to 45 minutes of physical activity must be mandatory, including yoga as well as dance. And in between the classes, 5 to 10 minutes of stretching or some small jogging, as we do in the NCD. We have done a lot of school programs in which we show that between the periods, 5 minutes of jogging in the class or stretches can also help to improve the circulation and the blood flow. And inclusivity in sports is very important. So most of the time you will find that the students, only those students who are active in sports or who are athletes are the ones who are encouraged. Or students who are obese or overweight or who are introverted are not really taken into the field sports. So that's something where inclusivity plays a very important role. Even handicapped children should be actually given the chance to play sports. Then classroom ergonomics. 30 to 65% report back pain and neck pain because of poor seating arrangements and heavy bags. If you see in India, the bag weight is about 15 to 20% of the body weight, whereas WHO says it should be less than 10% of the body weight. And poor lighting and ventilation, it actually causes fatigue and eye strain. So if there are adjustable chairs and desks, if they are provided with lockers, they don't have to lug these heavy bags to school, and improve the lighting and ventilation. Now sleep and school schedules. Now this again is very important. We know in the adolescent period that there is a process wherein their circadian rhythm changes, and most of the adolescents sleep late. And most of the time, about 11:30, 12, they are getting onto social media. So by the time they go to sleep, it is 1 a.m., 2 a.m. And again at 6 o'clock or 6:30, they have to wake up to go to school. So effective sleep is only for 4 or 4.5 hours. And this is linked to obesity, low immunity, and poor academics. So if you see in urban India, More than 60% of the children sleep less than 7 hours on weekdays. So it is important that many schools have started adopting it, so their senior classes are there in the second half of the school hours. They start from in the afternoon sessions. And balance academics and time for rest. And also talking about sleep hygiene is very important. Now this is something which is never taught in the school, that mobiles have to be switched off, they have to sleep at least about 10 hours, especially for the adolescent age group, and there should not be caffeine intake after 3 p.m. So there are many pointers which are not really discussed in school, but which has to be a very important part. Academic pressure, 33% report academic stress. And there could be also psychosomatic issues like headache, fatigue, and abdominal pain. So counseling is important, and there should be a shift from exams to projects. So projects can be graded, and it does not cause so much of stress as compared to exams. And sensitize the teachers to identify signs and introduce mindfulness and breathing. So academics and health are actually inseparable, and they should form a part of the school curriculum. Now, what is the impact on mental and emotional health? Again, if you see poor academic performance, it leads to chronic stress, and this increases the risk of anxiety and depression, hypertension as well. Less than 10% of the Indian school have counselors, qualified counselors in school. Body shaming and comparison are quite common, and this leads to increased incidence of eating disorders in school and depression. Victims of bullying, they occur, again as I said, more on the playfield and 2 to 3 times more likely to develop anxiety as well as depression. Discrimination, again this happens mostly on the fields or outside the classroom. It leads to withdrawal, school refusal, and self-harm. So what are the tips? The tips is supposed to be, you should have supportive schools where there is a 30% higher self-esteem and resilience is developed. Strong student-teacher relationship, it improves the bond and it decreases depression risk by 50%. And peer group programs are very important because they decrease dropouts by 20%. So healthy school is actually leads to lower stress, stronger support and safer environment, and more resilient adolescents. A fit and an emotionally stable child performs better academically, and this makes health promotion a very major part of the academic strategy. Then we come to improve resilience. So academic stress, we have said, if there's academic stress and performance pressure, they could go into project development and reduce the rote learning. Exam workshops can be taken up. Teacher-student relationships is very important. Mentorship programs again become important. Positive reinforcement. School counseling and mental health services should be there. And if they do not have a professional counselor, at least they should train one of the teachers to go in for counseling and get them trained up. Peer pressure and bullying. Anti-bullying policy should be important, and awareness campaigns and peer-led clubs. Building self-esteem and resilience. So life skill sessions should be taken. Majority of the schools have started doing the life skill sessions, but there are still schools which have not taken them up. Extracurricular activities are again very important, and recognition beyond academics. Teacher and parent alignment. Many times parents keep on shouting at the teachers, and teachers cut themselves off from the student. If there is a problem, the student will not come and tell the parents because they feel that the parents will go and complain to the teacher, and the teacher is going to take out khunnas, as we call it, on the student. So that's one of the very important things which have to be kept in mind, that parents and teachers have to be aligned on the same plane. Now, I'm not going to cover peer pressure. Please do not cut the line. Hello, am I audible? Yes. Okay. So, huh? Okay, this is working. So peer pressure can either protect or endanger health, so I'm not going to get into that. Now, what is the role of the teachers? Now, teachers play a very important role, okay? So a positive teacher-student bond, it actually decreases depression by 50%. And supportive teachers who are there, they can increase motivation and improve academic performance by 23%. Empathetic teachers, they can buffer stress and anxiety. So teachers are basically the gatekeepers. So they have to identify the behavioral science, physical science, and academic science. What are the behavioral science? Whether there is irritability, withdrawal from the peers, sudden defiance, giving up on academics, I don't want to go to school, I don't want to study, I'm going to be a school dropout. So these are behavioral science. Physical signs either of obesity, frequent tiredness, headache, they all mask certain stress. An academic sign, which means sudden decline in grades, unfinished homework, or falling asleep in the class. This is very common. In the first or the second period, a large number of children fall asleep in class, especially if they start early. Then inclusivity decreases bullying, risk-taking, and improved attendance. So teachers are mentors who inspire, educate, coach, share, influence, and encourage students. Then very quickly I will go through the competition and the extracurricular activities. Healthy competition helps to build up resilience, teamwork, and goal setting. It increases academic performance by 15 to 20%. And sports is a very important this thing which helps to build self-esteem. But excessive competition, as we know, it leads to exam stress and sleep issues and headaches. So over-competitiveness, it leads to mental health issues and maladjustment coping skills, which would lead to low motivation, absenteeism, and helplessness. So how would you balance it? Balance with collaboration, I think you mentioned. Balance with collaboration. There is collaborative learning. So if they study together in a group and with collaborative learning, it increases better problem-solving skills by almost 12%. Increases the social skills, fosters empathy, increases interpersonal relationship skills by 15 to 20%, self-esteem by 20%. Arts and music, it improves the creativity, and once creativity increases, it improves the resilience and decreases stress. Sports builds empathy, cooperation, and leadership skills. So regular positive feedback from the teachers, from the parents, from the friends, it gives a 17% better outcome. And stress management programs are also very important. So extracurricular activities actually form buffers for physical, mental, and social health. So school infrastructure, this we don't look at it. School infrastructure is very important because if the infrastructure is not good, it causes a lot of physical health issues and injuries. So a good infrastructure, it decreases injuries by 40%. Playground must have boundaries. Poor labs and playground, they lead to burns and fractures and head injuries. And even the trained adolescents, so first aid kits and training is very important to be taken up in the school section as well. And secure transportation. The buses should have CCTV cameras, attendance, and speed control. So school safety is actually non-negotiable part of adolescent health. School ecosystem, they act as a determinant of health. So success is equal to grade in our country, which actually leads to stress. And fear of failure and rigid discipline, it leads to school avoidance. So if the child stops going to school, it causes mental health challenges, declining performance, career confusion, and identity confusion. So they must integrate structured mental health services, peer mentoring, and stress management. So some of the policies, which are the nutritional program, counseling and stress, supportive mentoring, increased resilience. So there is a large number of policies. So if you look at adolescents' blood pressure and BMI are not only influenced by calories and genes, but also by timetables, report cards, and playground dynamics. This is something which is very important to understand. Playground dynamics, and this has to be repeatedly told to the school principal and the school teachers. Then last, school, family, and doctor. They form a triad of support. So it's basically a shared ecosystem. The school is the daily observer with the teachers and the counselors. The family is the emotional anchor, which influences the self-esteem, career choices, and lifestyle habits. And pediatricians are mediators and guides who conduct the regular school screening in the schools, counseling, advocacy with the schools, and pediatricians should also screen for stress, counsel families, and advocate for balanced, inclusive school practice. So schools shape behavior, families shape values, and doctors shape health. And as a triad, they just don't treat illnesses, they prevent crisis, nurture resilience, and unlock the potential. So thank you so much for patient hearing.